first step in learning to perform a venipuncture is knowledge of the needed equipment. Considering the many types of blood samples that may be required for laboratory testing and the risks to both patients and healthcare personnel associated with blood collection, it is understandable that a considerable amount of equipment is required for the procedure. Procedure. Step 1. Obtain and examine the requisition form. Step 2. Create and reassure the patient and explain the procedure to be performed. Step 3. Identify the patient verbally by having him or her state both the first name and last name and compare their information on the patient's ID band with the requisition form. Step 4. Verify if the patient has fasted, has allergies to latex, or has had previous problems with venipuncture. Step 5. Select correct tubes and equipment for the procedure. Have extra tubes available. Step 6. Wash hands and apply gloves. Step 7. Position the patient's arm slightly bent in a downward position so that the tubes feel from the bottom up. Do not allow blood to touch the stopper puncturing needle. Do not let the patient hyperextend the arm. Ask the patient to make a fist. Step 8. Apply the tourniquet 3 to 4 inches above the antecubital fossa. Palpate the area in a vertical and horizontal direction to locate a large vein and to determine the depth, direction, and size. The median cubital is the vein of choice, followed by the cephalic vein. The basilic vein should be avoided if possible. Remove the tourniquet and have the patient open his or her fist. Step 9. Clean the site with 70% isopropyl alcohol in concentric circles, moving outward and allow it to air dry. Step 10. Assemble the equipment as the alcohol is drying. Pull the plunger back to ensure that it moves freely and then push it forward to remove any air in the syringe. Step 11. Reapply the tourniquet. Remove the needle cup and inspect the needle. Step 12. Ask the patient to remake a fist. And anchor the vein by placing the thumb of the non-dominant hand 1 to 2 inches and pulling the skin taut. Step 13. Smoothly insert the needle into the vein at a 15 to 30 degree angle with the bevel up until you feel a lessening resistance. A flash of blood will appear in the syringe hub when the vein has been entered. Pull back the syringe plunger slowly using the non-dominant hand to collect the appropriate amount of blood. After releasing the tourniquet, step 14. Cover the puncture site with gauze. Remove the needle smoothly and apply pressure. Step 14. Fill tubes in the correct order. Mix anticoagulated tubes as soon as they are removed from the transfer device. Step 15. After tubes are filled, the entire syringe and blood transfer device are discarded into a sharps container. Step 16. Label the tube and confirm identification with the patient. Step 17. Examine the puncture site and apply a bandage. And thank the patient. Remove the gloves. And wash wash your hands.